We have now completed our study of the nervous system and we are beginning a new chapter, the cardiovascular system. In this series, we will explore the anatomy and physiology of the cardiovascular system through concise, easy to follow videos. Together, we will break down each and every structure and function of this vital system step by step. So, welcome to this medical lecture on the anatomy of the human heart. In this video, we will explore its location, size, shape and orientation within the chest, followed by a detailed look at its four chambers and their functions. Let's begin. General heart anatomy. The heart is a muscular organ located in the mediastinum, the central compartment of the thoracic cavity. It lies between the lungs, posterior to the sternum and anterior to the vertebral column, resting on the diaphragm. It is tilted slightly with about 2/3 of its mass on the left side of the midline. The heart is rotated such that the right atrium and ventricle face anteriorly, whereas the left atrium and ventricle lie more posteriorly. The heart is a muscular cone-shaped organ. The apex, the pointed tip of the heart, is directed downward, forward and to the left, sitting at the fifth intercostal space just medial to the mid-clavicular line. In contrast, the base of the heart lies posteriorly and superiorly, primarily formed by the left atrium. An average adult heart is roughly the size of a closed fist, measuring around 12 cm in length, 8 to 9 cm in width and weighing between 250 to 350 grams depending on gender. The heart consists of four chambers, two upper chambers called atria and two lower chambers known as ventricles. These work together to maintain a one-way flow of blood through pulmonary and systemic circuits. The right atrium receives deoxygenated blood from the superior and inferior vena cava and the coronary sinus. Its walls are thin and the inner surface features auricle, which is a small muscular pouch that increases atrial volume. Crista terminalis, a muscular ridge separating the smooth posterior wall from the rough interior wall formed by pectinate muscles. Fossa ovalis, a depression in the interatrial septum, remnant of the fetal foramen ovale. You can find these features in the diagram on the right side of the slide. Right atrium collects deoxygenated blood from systemic circulation and pumps it into the right ventricle. The left atrium receives oxygenated blood from the lungs via four pulmonary veins. Its walls are smooth except for the auricle, which is more tubular and contains some pectinate muscles. The left atrium pumps blood into the left ventricle through the mitral valve. The left atrium with right and left pairs of pulmonary veins are shown in the diagram on the right. The right ventricle pumps deoxygenated blood into the pulmonary trunk through the pulmonary valve. Its walls are thicker than the atria but thinner than the left ventricle. Inside you will find trabeculi, carnii, papillary muscles and chordae tendineae, which anchor the tricuspid valve and prevent its prolapse during contraction. You can find these features in the diagram on the right side of the slide. The left ventricle is the most muscular chamber of the heart. It pumps oxygen-rich blood to the entire body through the aorta, making its walls the thickest. Like the right ventricle, it contains trabeculi, carnii, papillary muscles and chordae tendineae, but they are more robust to withstand higher pressure. You can see the difference in the thickness of right and left ventricular walls in the diagram on the right. Here is a quick comparison of all four chambers. To summarize, the heart's strategic location, distinct chamber structures and directional flow ensure continuous circulation of blood. Understanding these anatomical basics lays the groundwork for learning cardiovascular physiology and pathology. Thank you for watching. If you found this video helpful, don't forget to like, share and subscribe for more medical education content. Stay curious and keep learning.